Assalamu alaikum. Today our topic of discussion is skin lesions. Macroscopic lesions. There are few types of skin lesions. Number 1, excoriation. Number 2, lichenification. Number 3, macule patch. Number 4, papule nodule. Number 5, plaque. Number 6, pustule. Number 7, scale. Number 8, vesicle, bulla, blister. Number 9, wheal. Firstly, we discuss about excoriation. The definition of excoriation is traumatic lesion breaking the epidermis and causing linear area deep scratch, often self-inflicted. Excoriation disorder, also referred to as chronic skin picking or dermatillomania, is a mental illness related to obsessive compulsive disorder. It is characterized by repeated picking at one's own skin, results in area of swollen or broken skin, and causes significant disruption in one's life. As shown in the figure, differential diagnosis: necrotizing vasculitis, bullous skin disease. Number 2, lichenification. Definition: lichenification is a secondary skin lesion that is characterized by hyperpigmentation, thickening of the skin, and exaggerated skin lines. These skin lesions usually appear from constant scratching or rubbing in areas such as the elbow. Background: secondary skin lesion, hyperpigmentation, thickening of the skin, exaggerated skin lines. There are three important points of lichenification, which are hyperpigmentation, thickening of the skin, exaggerated skin lines, which are developed from the constant rubbing or scratching. This is the histology of the lichenification. The differential diagnosis: allergic contact dermatitis, alopecia mucinosa, follicular mucinosis. Number 3, macule patch. Definition: circumscribed flat lesion distinguished from the surrounding skin by color. Macule is 5 mm or less than 5 mm, and patch is more than 5 mm, which is identified by simply looking at them, not traced. As shown in the figure, macule is small lesion and the patch is bigger lesion than the macule, which is more than 5 mm. There is histological representation of the macule and the patch. Differential diagnosis: post-inflammatory hyperpigmentation, cutaneous metal deposits. The next one is papule and the nodule. Definition: elevated dome-shaped or flat-topped lesion. Papules are 5 mm in diameter or less, while nodules are greater than 5 mm in size. Skin nodules are slightly elevated lesions on or in the skin. They are larger than papules, over 5 mm in diameter. The depth of the lesion is more significant than the width. Some are free within the dermis, some are fixed to skin above or subcutaneous tissue below. The patient will usually consult because of concern about cosmetic appearance or the possibility of malignancy. Papule is small, well-defined bump in the skin. It may have a rounded, pointed or flat top and may have a dip. It can appear with a stalk, be thread-like or look warty. It can be soft or firm and its surface may be rough or smooth. Differential diagnosis: sebaceous cyst, epidermoid cyst, lipoma, basal cell carcinoma, warts, xanthelasma, xanthoma, as shown in the picture. The next one is plaque. A skin plaque is an elevated, solid, superficial lesion that is typically more than 1 centimeter in diameter, a little more than half an inch, and associated with a number of skin conditions, most commonly psoriasis. Number 1, the word plaque is French for a plate, which is fitting because the lesions often like miniature dirty plates. As shown in the fig, a skin plaque or primary lesion can be flat or appear as thickened area of the skin that isn't visibly elevated above the surface of the skin. Skin plaques can have defined borders or not, and they can take on many different shapes. The differential diagnosis may include seborrheic dermatitis, tinea capitis, lichen planopilaris in the scalp, lupus erythematosus. The histological representation: the pustule. Pustules are small, inflamed, pus-filled blister-like sores lesions on the skin surface. Background: small pus-filled cutaneous lesions anywhere on body, most commonly on face, chest and back. Red bumps with white or yellow centers. Signs and symptoms: pain, tenderness, swelling, soreness, warmth. Treatment typically resolves on topical or oral agents. Causes include infectious and non-infectious skin conditions. Infectious include bacteria, viruses, fungi, parasites. Non-infectious are acne, rosacea, psoriasis. Diagnosis of physical examination, medical history, microbial culture, and biopsy. The differential diagnosis may include seborrheic dermatitis, tinea capitis, lichen planopilaris in the scalp, lupus erythematosus. The scale. Scales are visible peeling or flaking of outer skin layers. These layers are called the stratum corneum. They represent a heaping up of the outermost layer of the skin, the stratum corneum, and can be due to a variety of the skin conditions, most frequently excessive dryness. The differential diagnoses are lichenification, psoriasis, vesicle bulla blister. A vesicle, also known as a blister or a vesicular lesion, forms when fluid becomes trapped under the top layer of the skin epidermis, creating a bubble-like sac. Skin vesicles can be caused by chickenpox, eczema, rash due to skin irritation or allergy, shingles, friction, bacterial infections, and herpes simplex. Bulla. A bulla is a fluid-filled sac or lesion that appears when fluid is trapped under a thin layer of your skin. It is a type of blister. Bulla, pronounced as bully, is the plural word for bulla. To be classified as a bulla, the blister must be larger than zero point 0.5 centimeter, 5 mm in diameter, Smaller blisters are called vesicles. As you can show, as you can see in the picture, wheal, a raised itchy pruritic area of the skin that is sometimes an overt sign of allergy. Whales typically have a reddish hue. They characteristically change in size and shape and they come and go, but they are consistent at being smooth and elevated above the surrounding skin. As anyone who has had wheals knows, they can be intensely infuriating itchy.